Let's continue that theme. We're talking about healthcare once again, and this time we're going to focus on mental healthcare and the differences since the pandemic. And our next session in itself is helping to break down some of that stigma, because of course to talk about it is to tackle it. For many, the pandemic of course put our mental health under the spotlight, it put it under strain too. But it also helped boost things like digital solutions, virtual support systems for those who were struggling to access the healthcare that they needed. So in this next session, we are going to look at new innovations that are not only improving access to mental health care, but also dismantling the stigma around it. So to help me explore this, please welcome Steve Peralta, who's with me, co-founder and chief wellbeing officer at Unmind, Steve Cottle, who's here, global partnership director at Lyra Health, Ranjan Singh, who's here with us, chief executive and co-founder at HealthHero, and Amit Malik, who's joining us virtually, founder and chief executive of Amaha Health. Welcome to you all. Thank you for being with us. And Steve Cottle, let me start with you if I can. Take us back to 2020 and the pandemic, and as I said, it put our mental health under strain, but under the spotlight about the difficulty that people have accessing the help that they need, particularly, of course, when we couldn't get to physical facilities. Talk to me about that challenge, first of all.
So prior to the pandemic, we were on a journey anyway, and I think we've seen, here in the UK, our royal family talking about mental health. More and more countries were opening up. And certainly the generations coming through university and into the workplace now, we're already talking about mental health. Access became the challenge during the pandemic, as you quite rightly say. The world shuts down, how do we get people to access? Virtual and technology and what we for all do became quite fundamental in connecting people to the right people at the time. And that's continued post-pandemic.
And Ranjan, talk to me about how those systems have changed and what we're able to offer now. That I think I'm right in saying the technology existed. It was more about how we were choosing to use it, and the pandemic that brought about the necessity to use it.
Absolutely. Look, there was a lid of adoption kept on everything healthcare, mental health as well, and pandemic just blew that lid off. And there was overnight adoption. And to Steve's point, we see a fundamental shift earlier. 80% of the sessions in therapy would be face-to-face and 20% reluctantly remote. And now more than 80% easily is remote, and 20% or less is face-to-face. So that's been a phenomenal, fundamental shift. The second bit is the way the mental health model is, slightly controversial. All of us are on a spectrum, right? Yep. I mean, there is right at the bottom of the pyramid is people who feel a bit anxious and not presenting themselves as mental health cases. Then they're presenting, and then they're more acute, right? Technology can really help the bottom two layers in terms of digital self-help. The specific modules based on the assessment that is being done automatically, and very tailored kind of program of content could be presented, right? What it does is that also alleviates the pain on capacity. There isn't enough clinical capacity in there, and that's where digital self-help can help. The only caveat is that it still isn't proving to be the case fully, but we are on our journey alongside my fellow panelists to train people, the audience at large or patients at large, to be able to do that.
And I want to talk about stigma in just a second, but Steve Peralta, talk to me about the difficulty that many people have in squaring that circle, that one of the major influences on our mental health is our workplace. Yeah. And yet at the same time, we feel that it is something that we have to deal with on a very personal level without involving the workplace. And that mismatch is where some of the problems occur, isn't it?
Yeah, for sure. I think that's been the status quo for a while, is that the mental health of an employee is down to them. It's their individual responsibility. I think during the pandemic, we realized that our environment, our relationships, the culture we're a part of is also supremely important when it comes to our mental health, yeah. Right? You can't put an acorn in the wrong conditions and expect it to grow into a flourishing oak tree, right? So what's shifted now is that organizations have recognized that and have realized it is their responsibility as well to do what they can to create the conditions that better support the mental health and well-being of their people. And so it's not just the responsibility, what I think they've also realized is the very real connection between the mental health of the employees and business performance. And so it's almost become a necessity for them to do that well, which then makes just providing a digital mental health app insufficient. It certainly has a role to play, but you need to be able to then partner with a mental health provider in taking a really strategic approach, creating that kind of culture and organizational support that brings out the best in people.
Yeah, and I wanted to ask that, what does that support look like? Because you're right, so many businesses will send an email and say, hey, look after your well-being, take time off if you need it. Here's an app subscription for a bit of mindfulness. That doesn't even scratch the surface, does it?
No, it definitely doesn't. Like, you really need to take a comprehensive, holistic, whole organization approach. So you do need to support your employees, right? That can be with learning development programs, virtual therapy, coaching, that side of it, to help them understand the mental health and take care of it, and then recognize the role that leadership plays and management plays. I mean, we know that managers, there's a recent study that showed for 70% of people, managers have more impact on their mental health than their therapist.
Yep.
And so we need to be able to empower and upskill managers to be able to better support their people and create psychologically safe teams, and then do all this driven by data. So understand your workforce, understand your culture, and what needs to be changed to better support. So really, it's a whole organization thing.
Yeah, and Amit, I want to bring you in at this point as well. I see you nodding along there, and that's where an organization like yours, isn't it? You're able to offer those sorts of digital solutions.
So we combine everything, right? So I agree with what Steve was saying. You can't work in isolation. So we basically combine, I'm getting some background noise. We combine everything in terms of the digital support, then the teleconsultation, and then going right up to the in-person therapy and psychiatry, right? So actually bringing the whole ecosystem together, because our belief is that, and I'm a psychiatrist by background, right? So my belief is that the user really needs the whole gamut at some point in the journey or the other, essentially. So, so if you're in an ecosystem like the UK where you can partner with other providers, it's fantastic. But actually, in an ecosystem like ours, where I'm in India right now, where we're still building out the whole gamut, you build the supply and the provision on one platform yourself, and then you partner with them. So we partner with about 120 companies in India right now, right? And then we work directly with end users and families. So you're almost building that ecosystem and using the digital to connect all of it. So where self-help is delivered digitally, but then I'll give you an example. We see clients from 600 cities in India, and that's because outside the major cities in India, the availability of professionals in mental health is very, very poor. So in an ecosystem like India, which is very different to an advanced European country, you end up delivering a lot of this remotely just by an element of need and lack of choice, really, in some ways. So that access is digitally, but then having at the back end the in-person support, the psychiatry support becomes critical to then solve for the most complex cases. 10% of people we see in organizations, for example, have a severe mental illness. So, and as somebody was saying on the panel, for that group, it's just not sufficient to have a self-help tool. You need a lot more than that.
Yeah. And Ranjan, do we need to get beyond the idea that you only seek help at the most extreme end of the mental health problem? And actually, this should be a lifelong journey, that you can access this help in different stages with different formats at any stage in your mental health journey.
Absolutely. Like it is like physical fitness, right?
Yeah.
You don't choose your healthy living and physical fitness to be a finite thing. You eat healthy, you exercise, you walk on a daily basis. And that's precisely how mental health should be. And you should have what we call, let's say, a companion app digitally to be able to do that. There are then other aspects of it that we do see that, okay, that's good in concept, but the engagement drops beyond a certain point, right? There's the novelty value and then the engagement drops.
Is that when it's being outsourced to an app, for example? So
yeah,
it's in its most extreme case.
Exactly. So basically, if you're slightly anxious and you get through this app and you say, okay, I might use these tools and be healthy. We see that people use it for a few weeks and then they don't, right? So we as digital companies need to get better at constantly engaging and proving that tangible value points, just like a personal trainer in a gym session would do to you. You feel healthy, then you engage. And that is an ongoing journey. It's a very nascent kind of industry. And that's where we need to get to avoid that those extreme situations which are underserved currently.
Yeah, and Steve, then in a workplace, that is paramount, isn't it? Because you will go through various stages of mental health in a workplace, and actually if that resource is with you permanently all the way through, in the way that other systems in a workplace are, but has there been enough understanding that that is required?
It's increasing, the understanding and the awareness. For too long, the focus is on like the 1 in 5 that has a mental health problem.
And all the focus is around that one person.
But we all have mental health all of the time, like Ranjan was saying. So you need to be able to meet all layers of the pyramid. Technology can certainly support with those bottom layers, and then you need to know when you need specialized support for people in crisis. I want to pick up on one thing you said about engagement.
Sure.
Really important points, but also I think perhaps for too long, companies have been focusing on traditional engagement metrics like daily active usage, etc., which is not really fit for purpose, right? We're not dealing with Candy Crush. So I see a bit of a shift in terms of thinking about engagement more towards potency and impact. So someone might come on to the platform on one day, learn something that really transforms how they think about themselves or their lives, their relationships, and that could impact them for a while.
How do you measure that, though?
You might do it differently from organization to organization, but we would measure employee mental health and well-being. That's typically how we would do it.
Engagement's key. If you think about somebody who is going through coaching or counselling, you do that once a week, once every 10 days. If I was to ask anyone in the audience now to learn to play a guitar, but you only get to do it once a week, once every 10 days, you'll get better, you'll learn it, but it's going to take you a long time. That engagement in between sessions 100%. Is absolutely key to ensuring people continue. And technology plays that part. Technology enables us to engage with the individuals in between their sessions with a real human being, and we can keep them moving forward much quicker.
And you say it's a real human being. Is there a role for technology in that as well? Because we know resources are a problem, be it an organisation or public health systems. Can technology fill the gap when there is a lack of resource?
Yeah, absolutely. And I think technology plays a very, very good role in getting the right person to the right provider quickly. So navigating that. It also enables us to remove stigma. It almost also enables us to say, I need help. Hardest 3 words in any language, people, is I need help. And somebody picking up the phone to say that, that's a barrier. Being able to go through technology, identify how I'm feeling, and then actually book to see somebody without picking up the phone removes a barrier for a lot of people around the world.
Amit, let me bring you back in at this point, and I posed that question there about whether this should be a lifelong journey, and it's about reaching people in all these different ways, isn't it? So, I wonder though, at what point is the decision made that, technology cannot help you in this instance, you need to see a person face to face in a clinic. How does technology allow you to make those assessments?
I mean, so for us, we have very clear protocols around safety and clinical symptoms and diagnosis. So when somebody is presenting with risk, we very quickly recommend that they move to an in-person sort of support, in-person service. Also symptoms like psychosis, symptoms like very severe depressive illness, we prefer to see them in clinic. But also I think there are regulatory implications, right? There are medications that we can't by regulation prescribe remotely. So for all those very basic reasons, we have protocols set, and we do that from a human assisted level. We don't really at this point at least rely purely on technology to make those decisions. There are humans working alongside technology to be able to make those decisions for us today. We just think that's safer, especially with the segment of clients we are seeing who are on one of the moderate to severe end of the spectrum of mental illness. And so for that group, we do believe to be safe. We do an interplay of technology and human touch with trained clinical psychologists to be able to guide them through the journey essentially. So, but those specific cases, and then also client choice plays a big part in it. For a lot of individuals, what they prefer to see somebody face to face, the engagement is better, and our data shows that we see that the engagement and retention and a lot for therapy and for psychiatry is almost 50% more in our face-to-face clinics today, which is ironic given that our big push to digital, and then we have open clinics in at least the 3 metros in India, and we're seeing better retention and better stickiness at the clinics, which again tells you something about the nature of mental illness and what really works actually.
We've sort of talked, haven't we, about the kind of output end of this, the distribution of the services that you're able to provide. Talk to me, Steve, about the input. And there's no event that doesn't discuss AI, and this is no exception. In this field, AI makes a difference. Just explain how, particularly on that input end.
Yeah, it certainly has a role to play. There's obviously some controversy around it we can get to. But what AI can do, it can deeply personalize the support. Mm-hmm. It can make it accessible at scale. It can be anonymized, confidential. So we can, look, we're addressing stigma, it's reducing, but there is still a lot of stigma. So what AI can do is provide this anonymized, confidential source of support that can transcend the stigma and allow people to access it. But the obvious risks are, well, safety primarily, right? So this isn't the Wild West. It needs to be built by the right experts who are able to put the right guardrails in place. Otherwise, given the space we're in, we could be in dangerous territory.
Yeah, and talk to me about things like that, about the safety of it. And can AI say, look, this person really needs help, but also security of things like data for something that is so intrinsically personal?
Oh, absolutely. But responding to Steve's point about AI, it's also at the bottom of the pyramid that I mentioned. AI can actually do a very good job because currently, people provide the talking therapy just because there is a skills gap with 1 week of training, right? Mm-hmm. And AI models could be trained to do a much, much better job of that. So that's on the AI part. In terms of data and security, I do say that in our world, it's like safety in airlines. It's hygiene. I mean, no matter how fancy the airline cabin is, you're not going to fly it if it's not a safe airline. So we take that like most other companies very seriously. The basics, GDPR compliance and stuff aside, we have 3 principles that minimization. So we collect the minimum required data. We don't ask for anything more than is strictly required. Then there is anonymization. So we have tools and protocols to anonymize that, and encryption. Any messaging, any communication that happens is totally encrypted. And then you go in, we are in 4 countries, we deliver 5 million consultations. Every country has different regulation. We have to store data locally, and we have to have security measures and protocols which adhere to those countries, and that includes countries like Germany and France. Germany in particular is totally paranoid about it. So those are the basics we need to get right.
And Steve Cottle, a final word from you, if we will. We talked there about resources. What is the interaction right now between public sector and private sector? Because the private sector will inevitably have to play a greater role in this. And I wonder what those conversations look like right now about the private sector can solve some of these problems facing health services around the country, around the world. What are those conversations right now? Is enough being done?
In a word, no. The private sector has a fantastic opportunity to help support that. But the global economic environment means that the public sectors typically don't have the funds to participate. So it's that balance between...
But does digital lower that barrier or lower the resource requirements?
To a degree, yes. But it doesn't remove them completely.
Yeah.
And I think that's where the challenge lies. And I think you're going to have fun next week, I have no doubt. Mm-hmm. And that's going to be one of many general elections around the world this year. And where we look at the end of that, who knows?
Well, that's the message, isn't it? It's always, there is money, it's just how governments of any colour choose how they will spend it. So our time is up, sadly, but thank you to all of you. Please show our thanks, if we will, to Steve, also with us, Ranjan and Amit. Thank you so much. Nice to see you all.
Thank you.